Hi, I'm Dr. Charlene Koch. I'm a naturopathic physician and licensed acupuncturist in the state of Washington. Today I would like to talk to you about what a naturopath is, our unique whole body approach to medicine, how we're similar and different from conventional doctors. I would like to share with you my own medical journey to give you an idea of some of the similarities and differences. When I was a teenager, I had a medical crisis and I went to my primary care doctor, and my primary care doctor sent me on to an excellent specialist, and the specialist sent me on to multiple specialists for extensive imaging and blood work. And the conclusion was I definitely had a disease process going on, but we didn't know what it was. And all they had to offer me was a medication. It was off-label, and that had potentially serious side effects. The experience left me really confused, and I felt that the experience with the doctors, even as well-meaning as they were, the environment was very cold and clinical, and I didn't feel heard or listened to. And there was just a lot of miscommunication between the different providers. I was wondering at the time, was there anything that I had done that had contributed to this disease, and is there anything that I could do differently moving forward that would change the course of my disease process? And I didn't really get any clear answers. No one really knew the answers to that, but those were the lingering thoughts that were in my mind going forward. And I knew that the diet had a huge impact on the symptom expression. I had experienced the standard American diet, I had experienced a traditional Japanese diet, and I experienced a Mediterranean diet. And I knew that each of those different diets had a different outcome in terms of how I felt. I decided to continue on with my passions despite how I felt and not knowing what the outcome in the future was going to be for me. I decided I wanted to be a clinical psychologist, so I went to the University of Washington and received a bachelor's of science degree in psychology. And after I graduated, I wasn't sure if I wanted to do that anymore, so I went back as post-bac, and I took I did an exploration of a lot of different classes, and I did all my pre-med classes. And then I decided I was in the process of going to the University of Washington Medical School. And my mom at that time was diagnosed with cancer. And I decided for that year that I was going to be her primary care giver and her patient advocate. So I went with her to all of her doctor's appointments, and once again we were sort of thrust into that system where we were seeing multiple specialists. There wasn't really a clear course of what we should do in her disease process, and a lot of the options were had very serious side effects. And then we decided that we would go to Bastyr University and see a naturopathic physician, and immediately there was a difference in the patient-doctor interaction. The questions that they asked, the way that they approached her condition, the treatment options were completely different. And at that point, I was so intrigued that I changed the course from going to the University of Washington Medical School to wanting to become a naturopathic doctor, and I applied to Bastyr University. And so the difference is, some of the really big differences that I see between conventional doctors and naturopathic doctors is naturopathic doctors are really interested in the mind, body, and spirit. They're just not focused on the body and the symptoms. We look at the whole picture, the whole complexity. We really believe in the healing power of nature and our own ability, our own self-healing mechanisms. So we're really versed in how do we help assist the patient's own healing ability. And we don't just, the symptom to us is just a clue. It's just a clue of the body's expression that something is going wrong. And it gives us an idea of how we can intervene. And so just this whole approach of really seeing the person as a whole person is, and creating this patient-doctor therapeutic interaction in this healing environment just really stood out to me. And also not just studying conventional medicine, but also they incorporate all of the traditional medicines around the world. And I'd had enough experience at that point in different cultures and experiencing different forms of medicine to know that there was more than just this conventional medical model. Naturopathic doctors are licensed in 20 states, 5 provinces, the District of Columbia, U.S. Virgin Islands, Puerto Rico. And just like conventional medical doctors, we have our own boards that we must pass before we're licensed. We also take all of the same basic science classes, such as anatomy, a year of dissection, histology, biochemistry, physiology. Besides all of the basic sciences, we're also additionally trained in nutrition and using nutrition and supplements and therapeutic interventions and using diets to help modify disease process. We're also trained in behavioral sciences, so psychology, counseling, mind-body connection, creating that therapeutic environment between the patient and doctor. We're trained in physical medicine, so sports medicine, exercise programs, osseous and tissue manipulation, hydrotherapy, so using hot and cold water and different therapies to stimulate the healing body, that stimulate the healing, the healing body or the healing, your healing capability. We are trained in homeopathy. We're trained in botanical medicine using plant materials medicinally. And then we're also, because we're primary care doctors, we are also trained in minor surgeries, so sutures, lacerations. We do general physicals, PAPs. We do IV therapies. We do injections. And we're also have full prescriptive pharmaceutical rights. The only thing that we can't prescribe is controlled substances. And you will see naturopathic doctors working in a variety of settings. Most of them are working solo as a primary care provider, but others are working in integrative clinics with MDs, with conventional medical doctors. And we do refer back and forth to one another. And you're also going to see naturopathic doctors owning their own supplement companies. They also work as health educators. A lot of them are instructors in universities, conventional and naturopathic schools. So I hope this was helpful and it gives you an idea of what a naturopathic doctor is and some of the similarities between conventional doctors and naturopathic doctors. And we'll leave a couple links below that you can, if you would like to explore it a little bit further. Thank you for watching. I hope it was helpful.